I have been on the quest to try to get medical personnel to listen to my theory, which I think is the reality, on autoimmune disease as well as chronic pain issues. I have experience in this both personally and as part of my just curiosity. I partook in a study, which was me and about a dozen other ladies for chronic pain. And a lot of the people in the study were not forthcoming with information because they don't want to hurt the medical personnel's feelings. These are people in very high, prominent positions, and they're trying to get honest information from us. And we are given assignments to see what could possibly help. Now, I knew that a lot of the interventions didn't work for me. No one else was speaking up, so I piped up. And as soon as I started divulging things, then the rest of the patients all came out and just backed me up. The electric therapy didn't work, the medications didn't work, the pelvic floor therapy didn't work. And of course, medical personnel don't like hearing this because now they're outside their scope. They do things based on proven data from the medical industry. And as we know, the medical industry needs to have a standard prior to having a standard of care. So their standard doesn't go beyond the reach of what measures are already used. Okay? So they like to shuffle people with chronic pain and autoimmune where they can't help them and they can't cure them. They like to shuffle them into the psychosomatic category, which means it's all in your head. Now, is it all in your head? Yes and no. It is not a figment of anyone's imagination, but it has a lot to do with neurology. So, since they won't listen, I'm going to share this with you. If you have any type of chronic pain or autoimmune, I want to break it down into little bite-sized pieces on why I believe you may suffer from these things. So I'm going to go directly from definitions here, and I think you will quite easily follow along with where I'm going. Okay, so pain receptors, known as nociceptors, are specialized sensory neurons that detect potentially harmful stimuli and initiate the sensation of pain. So that is what it is. Pain receptors or nociceptors are specialized nerve endings located throughout the body, including the skin, muscles, joints, and internal organs. They detect potentially damaging stimuli such as extreme temperatures, intense pressure, or harmful chemicals and convert these stimuli into electrical signals that travel to the spinal cord and brain, where the sensation of pain is processed and perceived. Nociceptors are distinct from other sensory receptors because they have a high activation threshold, firing only when stimuli are strong enough to potentially cause tissue damage. I don't want to go off on a tangent, but this goes into some of my other videos that aren't so much just about health. Okay. My diving in was about trauma, how trauma is processed through pain receptors. So, can trauma impact pain receptors? Yes. Nociceptors, the sensory neurons responsible for detecting pain, can be directly and indirectly affected by trauma, both physical injury and emotional trauma. They both can trigger structural, molecular, and functional changes in these neurons, contributing to acute and chronic pain states. This means that the plasticity of molecular structures can be retrained from trauma, physical or emotional trauma. Okay, so now we're looking at neuroplasticity. When I think of nerves and I think of neuroplasticity, I immediately want to dive into myelin sheath. We already know that the degradation of myelin sheath can impact people's health, definitely with firing of the nerves and the synapses, and we see that with Parkinson's and other illnesses that are deemed autoimmune as well as structural and anatomical anomalies. Does the myelin sheath affect pain receptors? Yes. The myelin sheath can directly influence pain pathways and pain receptor activity, both on normal and pathological conditions. Stay with me here. What degrades the myelin sheath? Okay, physical injury or trauma, chronic inflammation and tissue damage, nerve compression or entrapment, neurodegenerative diseases, systemic diseases affecting nerves, chemical or toxic insults, age-related changes, and those are all the things that can degrade and damage the myelin sheath as well as pain receptors themselves. Keep this in mind as I go to the next one. Can non-physical trauma degrade nociceptors? Non-physical trauma, such as chronic stress, prolonged psychological distress, or certain systemic diseases, can indeed influence nociceptors, though it doesn't always cause a direct structural degradation in the same way that tissue injury does. And it goes back to the neuroplasticity, the plasticity of the molecular structure. This is where it gets fun. Can fascia impact nociceptors? Yes. Fascia is richly innervated and can directly influence nociceptors, making it a significant contributor to pain, signaling in conditions like myofascial pain syndrome and other musculoskeletal disorders. Last but not least, can trauma impact fascia? Trauma can deeply affect fascia, the body's continuous web of connective tissue that surrounds muscles, organs, bones, and nerves. Oh, that's what it was. Sorry, the definition. While fascia traditionally functions as a structural support and a conduit for movement, emerging research and somatic practice shows it also plays a role in storing and processing emotional trauma. Okay. Why am I reciting all of these things? Because this has been my theory for a very long time, and I think putting it together is going to help patients fully understand why they experience certain things physically. Now, my whole take on this is that your body, your way of thinking, and the way that your brain is wired, as well as what you feed your body and what you've endured in life, all work in combination together for your whole being. This is not so far out of the realm of regular old wellness conversations. But when it comes to the medical industry, again, everything is compartmentalized and they have a hard time wrapping their mind around all of this. So even when I deliver this in a scientific manner, I get a lot of pushback. But this is where I come from with all of my studies on anatomy and clinical massage therapy, fitness training. Even when it comes to mediation, you get to know how everything works. So this is my theory. I believe that some people have degradation of the myelin sheath because they have some type of disordered eating. People who encounter trauma tend to not have the best diet. Either they don't eat enough or they have some type of unhealthy eating pattern where they eat a lot of garbage. Now, we already know the myelin sheath needs cholesterol for its structure. And if we don't feed our body correctly, then that structure degrades. Hence, the myelin sheath degrades. The myelin sheath insulates the pain receptors. Therefore, if that sheath degrades, you are going to have misfirings and you're going to have pain issues. Due to trauma, like we just read, sometimes that creates prolonged stress. Stress inflames the body. So when the stress inflames the body, we see a lot of autoimmune issues that stem from inflammation in the body, where the body's trying to attack the invaders and mistakes the actual bodily structure and makeup as the enemy that's doing the invading. So the body is very smart. There are some anomalies going on in the bodily structure caused by stress, which is caused by trauma. And there you go. You have the body attacking itself. Again, that affects the pain receptors and it affects your immunity. Now, I like to bring in the fascia conversation coming from the clinical massage therapy. As you heard, the fascia surrounds everything in your body. It's what keeps your organs in place. It keeps all your structures in place. We know that. In massage therapy, we also know that sometimes people can have pain in one area, but it's due to a fascial disruption or adhesion somewhere else. So the way it was explained to me in school was like a sweater. When you have a little string pulling from your sweater, and if you try to pull it out, the sweater starts crunching in a different area. It's because it's all connected. So we know that fascia does connect to everything in the body. So having one physical ailment or having one adhesion can affect the fascia in the rest of the body. Now, it doesn't need to be a physical trauma. If you are stressed out and your body is inflamed due to trauma, you are going to have knots and adhesions and stuck fascia in parts of your body, which is going to pull on every other area of that fascia. And since that fascia surrounds bone, tissue, muscles, what do you think happens? It is pulling those structures out of place, causing pain. Now, if your body isn't doing what it needs to be doing, again, your body will register invaders that are causing these issues in your body. And again, you will have your own body attacking itself. There we go with the autoimmune issues. Now, another thing I wanted to say pertaining to fascia is that I may have explained it before, and this is not my information, but I loved how it was delivered, so I'm just going to deliver it back to you. Fascia has a couple of layers, and in between the layers, it's very, very thin. I always compare it to the silver skin on ribs. That's how thin it is, and you gotta rip off that silver skin before you put it on the barbecue. To me, that's how I visualize the fascia. It's a big web of connective tissue that is very tight to all of the structures. So there's a couple of layers, and it's designed to glide. It's designed to glide, it's designed to move, and if you're nice and hydrated and you don't have any physical ailments, you don't have any trauma, it glides and there are no issues. Now, if there is any physical trauma or emotional trauma, it can tighten up, and that jelly in between those flaps right there turns into peanut butter. So instead of gliding like jelly, it gets stuck like peanut butter. And that's what happens when your fascia is not healthy. That could be due, again, to dehydration, but also to trauma and stress when your whole body is tense, when your whole body is inflamed. So imagine what happens if that fascia is that cling wrap gets too tight around different organs. What do you think is going to happen? I know in my case, in the case of the study that I partook in, the ladies and I all had pelvic pain, which means all of that fascia around all of those organs in the pelvic arena cling tight. Diving in further during this study, which I won't get too detailed because it's confidential, but each member of the study did have trauma in their past. So that made me scratch my head a little bit of why did 0 of the interventions medically work on any of us? Because it was due to medication which masks the pain. The medication doesn't rebuild your myelin sheath. It doesn't help you take down the stress in your life. It might temporarily take down the inflammation in your body, but if you have constant stress, you're going to have inflammation. And I started peeling back the layers with this. Medications didn't work. The electric therapies didn't work, again, because we have myelin sheath degradation. And now that therapy can actually make the pain worse. And when it came to pelvic floor therapy that all of us went through, everybody got worse from that as well. They got a little bit of temporary relief, maybe the first or second session. They stopped going because the pain just got worse. And then you start thinking what type of trauma people go through. It's not just physical trauma. Sometimes it is emotional trauma, growing up in an emotionally abusive household. Sometimes it's sexual trauma. But if we take those two things and we attribute it to pelvic pain, it would make perfect sense that pelvic floor therapy would not work on these chronic pelvic pain patients. Why would that be? because the fascia is already strangling those pelvic organs. It's too tight, no matter how hydrated. And that is the purpose of pelvic floor therapy, where they go internally and pretty much trigger point structures so that they can relieve pain, they can relieve sexual dysfunction, they can relieve incontinence, or in our case, it wasn't incontinence, it was not having the ability to go to the bathroom at all because the tension was so high, everything was so hypertonic. So not letting go of that stress and tension. So when you get pelvic floor therapy to trigger point internal trigger points and you already have a tight fascia and you are performing this on someone that already has emotional trauma, which means usually we have a hard time trusting people, and or sexual trauma, which means that area is being guarded like the dickens. Muscularly guarded, emotionally guarded, psychologically guarded, fascially guarded. So again, it makes sense to me why the pelvic floor therapy wasn't working and made things worse, is because you are addressing the one area where all of the pain is stored, where all of the pain is felt, and we're not addressing all of the structural issues that can occur from physical impact as well as emotional impact. Now, to say that this is all psychosomatic, this is all in the head, just go to therapy, that does not work, because we're going right back to rewiring of the brain. We're going right back to neuroplasticity. So when you go to therapy and you were talking about your trauma, you are reliving that event over and over in order to relieve physical symptoms, physical ailments. But when you keep that type of narrative replaying in your head, you're not processing to get rid of it. You keep remembering it. And as you keep remembering the trauma, it keeps that pain alive. It keeps that inflammation and that stress in play. It keeps that fascia unglidable. So I just wanted to share with you my insight on this. What would be my solution? Of course, I'm a Christian, so I would say prayer. But I really think that a season of healthy isolation, a season where the patient takes time for themselves to explore something creatively, something that gets them to feel safe, to calm the nervous system. I think a period like that could be extremely helpful. I believe that this would, if you're experiencing a lot of autoimmune issues and a lot of chronic pain, I think having your husband or your wife around, or having your boyfriend or girlfriend around where you're dealing with their stressors as well, isn't going to do anybody any good. I'm not saying people need to break up their marriages or break up with their boyfriend or girlfriend. I'm just saying a strategic season of isolation in order to get in touch with yourself and not be searching for medical answers to your problems, and go a different route. Get in touch with how your body actually works. If you want to do a little research on the anatomy, I think that's great. But I think getting your head out of that pain space and going in, redirecting your energy into something creative that is going to show you how you are created magnificently, I think that makes the biggest difference. Now, obviously, I just divulged a little bit of information about myself. Yes, chronic pain. Yes, some medical things wrong with me, but people will look at me and say, how are you still functioning with all of the things that are going on in your life physically? And I just treat things very differently. I've learned a lot from my clientele that get on my table. I've learned a lot from my clientele that I take in for physical fitness. I have learned a lot from my clientele when it comes to mediation. And at this point in time, I cannot separate the mind and the body and the spirit from each other. It's too hard to compartmentalize all of them, because to me, they all feed into each other. And I know that sounds like one of those taglines in all these wellness businesses, body, mind, spirit. But I truly do believe that rewiring the brain is extremely wonderful. Neuroplasticity, people do it all the time without even knowing, but we only take it so far. Addressing the fascia, most people just address that in massage therapy. Now you have physical therapists, now you have doctors and surgeons that are talking about it, but massage therapists knew about it a long time ago, and so did fitness professionals, so did personal trainers. So putting all of these things together, I think, can really help patients that suffer from autoimmune and chronic stress. When I do work with people that have those issues, I do not tell them to stay away from exercise. I do not tell them to stay away from certain things. I dive in head on, especially with autoimmune, especially with the arthritis, especially with these things, because I know with fitness, with movement of the muscle, with the firing of the neurons, you're exercising the brain. Everything is truly connected. So getting your body to move is actually very helpful for the brain. Singing is very good for the brain. Writing is very good for the brain. Utilizing every sense that we have is good for the brain. When it's good for the brain, it is good for the pain receptors as well. So that's my little snippet on autoimmune and chronic pain, integrating pain receptors with myelin sheath, with trauma, with non-physical trauma, with fascia. I think it's extremely important to address all these things because you really can store a lot of emotional trauma in the tissues, in the fascia, and it is not hard to detect. It is not hard to detect whatsoever. So, on that note, I hope that wasn't too complicated. I hope you followed my weird line of thinking, and to be continued. Bye.